It's a little bit more complicated, but it's kind of fun. It's like more of a scavenger hunt. Welcome back to my channel. If you haven't seen any of my videos before, my name is Natalie. I'm a family nurse practitioner, and basically the goal of my channel is to help pre-nursing, nursing, as well as FNP students get through school as easily as possible. And I also take a look and review at resumes and personal statements. So if you need that done, please take a look at the description box down below, and it'll tell you about the whole process of how that goes. So this is part 2 of my little series of talking about my clinicals and resources that I've used and just tips and advice to help you guys get through your clinical. So for this video, I'm going to be talking about my pediatric rotation. So for this particular rotation, it was kind of the same as my adult rotation in terms of we as students, first of all, there are tons of students in this rotation as well. They would go in and we would see the patient ourselves. We would get a history, we'd get a physical exam, talk to the parent if necessary, do everything that we needed to do. Then we would go ahead and present to the providers, talk about what we think it is, what plan that we have, and we would both go in and finish out the appointment that way. So for this particular clinical, we did not have access to the EMR ahead of time. We were only allowed to access it when we got to the clinical site. So again, there are a lot of students, so we all decided who wanted to have what patient, and we would claim them, and then we would just do a quick little synopsis of what we were going to talk about, and then we would go in and see the patient. Now, a lot of the time, if they're relatively young, there's not a huge history that you need to go over, so in a way, it's not terrible that you're not able to really study the patient ahead of time, because sometimes there's really not that much to study. At least we hope if that's the case when you're super young, so that is a little bit different than adult rotation. The only main resource that I really used in this clinical, besides talking to the providers, was Bright Futures. It's a very, very good book, and if you're in school, they probably require you to have it anyway, but even if not, you can go to Amazon, and I think they have like a little teeny booklet of it, and basically what I use this for was for wellness checks. So basically a wellness check is just kind of like when you go to the doctor and you get a yearly annual. You go to see, is everything okay? Any new medications that need to be prescribed or anything like that. So a lot of times if you're like a 2-month-old or 3-month-old or whatever, you have these wellness checks that you have to come in for. So basically Bright Futures has a little area where they have, if you're 3 years old or 4 years old or whatever, this is what you should be doing with your gross motor skills, fine motor skills, this is how much they should be talking, this is how much they should be moving, they should be standing up, they should be able to hold their head up, by themselves, or they should be able to walk at this age. So those are different things that you can go ahead and write down ahead of time. If you know you have a 3-year-old, go to your Bright Futures, ask those certain questions or write it down, and then go in there and say, hey, is your baby walking? Is your baby talking? Is your baby cooing? Is your baby doing this or that, or your child or whatever? So that's something that you can help look at, so you can prepare, so when you go in there you can ask certain questions. Of course, if they're for an acute issue, it's different because you don't know what they're there for until they get there. Usually on the EMR they have the chief complaint, but it's not always going to be correct, and you have to go and obviously talk to the patient anyway. So that was really the only resource that I used. Our providers, there's a couple different providers at that particular location site, and they're really good about explaining things, teaching things. They had a lot of resources there at the site, but if you wanted to look ahead of time and just read a little bit more, Bright Futures is definitely the book to use, of course, as well as your pediatric book that your school requires you to have. So I really enjoyed that rotation. Of course, we saw newborns to people of, I think it was 21 years of age. I don't remember seeing anyone in their 20s. I think probably the oldest person I saw was maybe 17, but it's really a very nice experience. It's really cool to be able to see a wide range of people. It's nice to be able to talk to the patient, the kid themselves, as well as the parent, and kind of compare notes and see how things go. It was just a very interesting experience. It was a lot of fun. I just want to say that for me, I was a little bit nervous going into my pediatric clinical because I haven't had too much experience with little kids, but I just want to let you know that it's not as scary as you might think if you haven't been surrounded by kids a lot. It's a lot of fun. I really hope that you guys enjoy the rotation and have really good mentors, because this is going to be, I think it's a little bit more complicated than adults, just because not all the time for kids you can really, get out of them what's wrong with them. They don't even want to say, or of course if they're too young they can't speak, that's one thing, but if they're, little kids, they might be scared. It's a little bit more difficult. You're going to have to, choose your words a little bit differently. You're going to have to, it's a little bit more complicated, but it's kind of fun. It's like more of a scavenger hunt. But yeah, I really enjoy that rotation. At Bright Futures, I would definitely recommend having the actual book. It's pretty thick, or you can get the little pamphlet on Amazon, and if I can find it, I'll go ahead and link it down below. But yeah, so thank you guys so much for watching. I hope you guys have a wonderful morning, noon, evening, whatever time it may be. Remember to always, always believe in yourself. And again, if you need any help reviewing or looking over your resume or personal statement, please take a look at the description box down below. All right, you guys have a great one. Bye.